Hello, my name is Robert Henry. I am a student at Colorado Christian University enrolled in a bachelor's degree of science in healthcare administration. This presentation is for the class Healthcare Delivery Systems taught by Dr. David Bull. This presentation will cover options available for the funding of long-term care by the public government funding and private sector funding. Long-term care covers nursing homes for individuals with significant functional and/or cognitive impairment. Intermediate care facilities for individuals needing supervision and assistance, but not needing continuous care by a nurse. Home health services and home and community-based services. Shannon Muchmore covered a legislative debate in 2016 on public versus private options for long-term care. Muchmore pointed out long-term care can be extremely expensive and needs vary greatly among patients. The Bipartisan Policy Center estimates that 40% of patients will spend over $100,000 during their lifetime. In order to qualify for Medicaid, some individuals have to first exhaust their personal savings. In remarks by Representative Frank Pallone, Democrat, New Jersey, to the House Energy and Commerce Subcommittee, he stated his plans to introduce legislation to create a Medicaid or Medicare Part E to cover long-term care. He expressed the urgency to create reform. Conversely, Representative Michael Burgess of Texas, Republican, said he would oppose Medicaid reform and stating solutions could be found in the private sector through the purchase of a long-term care insurance policy like he had done himself. Alice Rivlin of the Bipartisan Policy Center Long-Term Care Initiative said that she and her colleagues agreed that private long-term care insurance should be more affordable to the public and there should be catastrophic coverage offered as a federal option. An option discussed was to have employers offer long-term care insurance as a retirement option that employees would have to opt out of. According to the SCAN Foundation, total spending for long-term care was $207.9 billion, which was 8% of all U.S. health care spending in fiscal year 2010. Long-term care expenditures were 62.2% by Medicaid, 21.9% by out-of-pocket, 11.6% by other private, and 4.4% by other public. Projections for long-term health care expenditures from all sources have an expected increase from $207.9 billion to $346 billion in the year 2040. Median annual costs for some selected long-term care services in 2020 are as follows. Nursing home, private room, $81,030 annually. Nursing home, semi-private room, $73,000 annually. Home health aide licensed, $43,472 annually. Homemaker services, $41,184 annually. Assisted living facility, one bedroom unit, $39,600 annually. And adult day health care centers, $15,860 annually. Expenditures pertaining to public financing are Medicaid long-term expenditures for FY 2010 totaled $129.3 billion, 31% of Medicaid spending. 45% of that spending was for home and community-based services, and 55% was for institutional long-term care. Out-of-pocket spending, the national median annually private pay cost for nursing home services averages 241% of an older person's annual income, whereas costs for home health services average 88% of an older person's annual income. 25% of people older than 45 are incapable of affording the cost if they suddenly require long-term care for an indefinite period of time. Private long-term care insurance. In 2010, approximately 9 million people, 7.4% of U.S. citizens over the age of 45, had a long-term care insurance policy. Employer-sponsored long-term care insurance represented a third of all active policies, the federal government being the largest employer offering long-term care insurance policies. Average annual premium for long-term care insurance policy was $2,255 for individuals ages 55 to 64, $2,759 for ages 65 to 69, and $3,294 for ages 70 to 74. Expenditures for the role of family caregivers. The most common long-term care is provided by family members and friends at no cost to the patient. However, the estimated value of unpaid service in 2009 was $450 billion. If included, the annual cost of long-term care would increase from $279 billion by 116%. One option not discussed by much more or the SCAN Foundation is faith-based healthcare for long-term care. Christian Care Communities is one example and offer community-based long-term care in 9 locations in Kentucky, home care and adult daycare. Christian Care Communities is a charitable non-for-profit founded in 1884, headquartered in Louisville, Kentucky. One location in Bowling Green that offers assisted living, independent living, nursing homes, and memory care. Assisted living starts out at $2,936 a month, which equates to $35,232 annually, in comparison to the national cost on average being $39,600 in 2010. While healthcare reform is struggling as bipartisan stalls progress, any new legislation introduced must address the growing cost of long-term care and how the burden of cost is being placed on the public, which is going into bankruptcy due to medical bills after depleting all their savings. As David pleaded with God, "Do not cast me off in the time of old age. Forsake me not when my strength is spent." I believe that the elderly population of this nation has the same feeling. And if we take the direction that Timothy gave Paul to do not rebuke an older man, but encourage him as you would a father, younger men as brothers, older women as mothers, younger women as sisters in all purity. Or if we simply just follow the commandment that Christ gave us to love our neighbors as ourselves. I believe that healthcare reform would target specifically the elderly population that is growing and has committed more to this nation than any other population. Thank you for your time. I hope I conveyed my thoughts well, and I look forward to any comments that you would post in response to this presentation. Thank you. Have a great day.